I'm Dr. Ryan Ouillette. I'm a board-certified orthopedic surgeon here at Florida Advanced Spine and Orthopedics. Today I'm going to answer some common patient questions regarding shoulder arthritis and its treatment.
What is shoulder arthritis?
Shoulder arthritis is a degenerative condition of the shoulder in which the articular cartilage begins to thin and break down. During this process, the bone will typically start to form spurs and can eventually progress to where you have bone-on-bone grinding in the joint with range of motion. Typically, this condition is characterized with significant pain with range of motion, as well as stiffness of the shoulder and loss of motion. People will start to have difficulty reaching overhead and reaching behind their back. And additionally, patients may feel popping, catching, or grinding in the shoulder when they move it.
What are the non-surgical treatments?
So some non-surgical treatment options for shoulder arthritis include rest, ice, anti-inflammatory medications, and physical therapy. Typically that may work for a period of time for some patients. However, if the pain continues to progress or becomes more severe, then a lot of times we'll incorporate shoulder injections. These can be performed either into the area above the rotator cuff or into the shoulder joint itself.
What are the surgical options?
Surgical options for shoulder arthritis include both an anatomic as well as a reverse total shoulder arthroplasty, which is a shoulder replacement surgery. The big difference between these two surgeries is that in an anatomic shoulder replacement, the ball is replaced with a new ball and the cup is replaced with a new plastic lining on the cup. So the orientation of the shoulder stays the same. However, in a reverse shoulder replacement, the ball and cup orientation gets switched. And this is typically performed for when the rotator cuff is not functioning appropriately. And additionally, a reverse shoulder replacement can be used for patients who have no arthritis and just have a large rotator cuff that cannot be fixed.
What can I expect before and after a shoulder replacement surgery?
On the day of the shoulder replacement, patients will typically get a nerve block performed by the anesthesiologist in the preoperating area. Afterwards, following the surgery, some patients are able to go home the same day. Otherwise, other patients will typically stay overnight in the hospital for one night and then typically go home on day one as long as their pain is under control. We typically will have patients in a sling for approximately 3 to 6 weeks, depending on whether they had an anatomic or a reverse shoulder replacement. Following that time, when they come out of the sling, there's several months of physical therapy and the expectation to be released to normal activity at about 3 months. To learn more about the care we provide here at Florida Advanced Spine and Orthopedics, please give our office a call or visit us online at fastmd.com.